let's do a brief recap of the scapular region. So we began with this picture, view of the right-sided scapular region from the back. So we talked about three spaces. This was the quadrangular region having the boundaries of the teres minor in the superior part. More anteriorly, it was the subscapularis muscle and the capsular shoulder joint. Most posteriorly, it was teres minor muscle. Now, inferiorly, it was teres major. Medially, it was long triceps brachii, and laterally, it will be the surgical neck of humerus. Structures passing axillary nerve, posterior secundus humeral vessels. We shift to the triangular space, lower boundary by the upper border of teres major, lateral boundary by the long triceps brachii, and this one, the upper boundary by the lower border of teres minor, right? Now, apex is supposed to be the lateral border of the scapula, where the two muscles, teres minor and major, converge. Structures passing circumflex scapular vessels. Fine. Bang opposite to it is the lower triangular space, bounded above by the lower border of teres major, laterally by surgical neck of humerus, and medially by the long triceps brachii muscle. Structures passing radial nerve and profunda brachii vessels. Right? Then you did this trick. A nice one indeed. Okay. What this diagram reminds us about, that is the sensory loss over the regimental badge area, and that reminds us of the injury to which nerve? Axillary nerve, because the upper lateral cutaneous nerve of the arm supplies this particular zone, and that is the sensory lost if the axillary nerve is injured. Besides that, it also causes deltoid paralysis, that is manifested as loss of convex contour of the shoulder and inability to abduct the shoulder joint properly, because deltoid muscle causes mid-range of glenohumeral abduction or shoulder joint abduction. Mid-range, not the incision, right? Now, this is a nice diagram depicting the insertion of the four rotator cuff muscles. Look at the four fingers that depict the insertion of the muscles. This is for the subscapularis at the lesser tubercle of humerus. These three are for the insertion at the three facets, three flat zones of the greater tuberosity. We begin with supraspinatus in the upper part, then infraspinatus, then teres minor. So all these four, namely subscapularis, supraspinatus, infraspinatus, and teres minor, nicknamed as SITS. The teres is the minor one, not the major. They will form the rotator cuff muscles. Okay, and they provide huge amount of stability to the shoulder joint from the upper part mainly. So that's what we talked about. Sits. Please note there is no major, it's minor over here. Teres minor. The cuff is deficient inferiorly, that makes the shoulder joint weaker inferiorly, and that's why shoulder joint commonly dislocates inferiorly. Clear? The most common rotator cuff muscle affected is supraspinatus, right? Subscapular is also often named as the forgotten muscle because of its deep disposition and location. Okay. Dobbin sign, very important sign, elicited where? In case of supraspinatus tear. What happens? In this case, the supraspinatus fibers are torn, causing inflammation of the subacromial bursa, which is present beneath the acromion process, right? So if you push along the deltoid, it will cause pain when the arm is adducted. Clear? But if you abduct the shoulder joint, the subacromial bursa will shift superiorly a bit, and it will be buried under the acromion process, so that it cannot be accessed from the deltoid zone. So if in abducted shoulder, if we press upon the deltoid, then the pain won't be felt, unlike when the arm was adducted. That's named as the Dobbin sign. Clear? Very important sign. Okay. So that's all from the scapular zone. Hope you were able to understand. Thank you very much.